Have you ever felt a burning chest pain? Have you felt like any small food you eat, you feel full? You cannot eat much. Do you belch a lot? It could be a sign that your diabetes has affected your stomach and intestine because that's a complication of diabetes. Most people think there is ulcer. No, for people that are diabetic, it is a complication of diabetes that resembles ulcer, in which individuals with diabetes easily feel full. You take small food and you don't feel like you can eat again. And after small time, you're belching, you're having serious lower chest pain and upper stomach pain that sometimes goes to the back. It is the diabetes that is causing it, not ulcer. You are aware that yes, ulcer gives that classical pain is worsen on eating spicy food, or sometimes if you're hungry, you feel the pain, or sometimes if you take maybe cola nut, or you take coffee, or you take Lipton, you feel that pain, or you take oily food. All these ones are characteristics of people that likely have ulcers, right? And there are many causes of ulcer. It could be from a bacteria called Helicobacter pylori, which is usually treated with 3 drugs. It could be because of analgesics, drug you take because of pain, and sometimes can lead to ulcer, especially your diclofenac. If you don't take it as advised by your doctor or your pharmacist, diclofenac, ibuprofen, Fildin, all these drugs can give rise to ulcer. Then you talk about people that are on steroids for different diseases, maybe leg pain, you're on prednisolone. If you take it for long, it can also give you this kind of symptoms. But today we are not talking about that. Our focus is on diabetes patient. So as a diabetes patient, if you have been diabetic for some time and your control is not good, it can affect your stomach. And if it affects your stomach, one thing it will cause is that you will reduce the movement of food in your stomach. So your stomach cannot easily empty. And if food remains in the stomach for long, what happens is that the acid in the stomach begin to go up. And if it goes up to your esophagus, that's the tube that carries food to the stomach, you start having pain on the chest. And the fact that the food does not go down, right, because the movement of the stomach has been affected by diabetes, you easily feel full. Because if you eat small, the previous food is still there, you eat again, you cannot eat much because the food does not go down, right? And also you will notice that you are more likely to be vomiting. Sometimes you feel that it's only after you vomited you have some relief. It's still part of the problem, and it's also it is referred to as gastroparesis. Gastro means stomach, paresis means weak. Your stomach is weak and cannot push food down and empty itself. So if you have yourself in this kind of situation as a diabetes patient, you need to quickly go to your doctor. And your doctor is going to give you certain medications. One of the medications that you give you is this antacid, that water that helps people with ulcer. But as a diabetic patient, make sure that any antacid you're buying should be sugar free, because some of the antacids have sugar. And if you have sugar, it's going to affect you. Secondly, it's going to give you a drug that will reduce the effect of the acid, right? We call them proton pump inhibitor, like the omeprazole. And it's also going to give you a drug that will help in the movement of the food down from the stomach to the intestine and for you to defecate it, right? But it's very important, if you're having this situation, that you eat your food with vegetables help to increase the movement of food in the intestine to ensure that it goes down. So it's very important. So try and the instruction of eating small with a lot of vegetables. So vegetables has a lot of advantages apart from giving you vitamins, giving you fiber. It also helps in the movement of food in your intestine. But for those who have other ulcer that are not diabetic, remember the advice that you always receive. Don't take spicy food. Don't stay hungry. Make sure you don't take oily food. Don't take caffeine. Don't take cola or things that have caffeine. Don't take carbonated drink because that gas will always precipitate or cause your ulcer symptoms to come about. So make sure that if you're diabetic and you're having the symptom of you become full easily, you belch a lot, you have symptoms of pain in your lower chest and abdomen like ulcer, it is because the diabetes has affected your stomach. So quickly discuss it with your diabetes specialist or the person that takes care of your diabetes, assist you deal with it.